guys, it's Coach Bridget, and I'm here with Dr. Shannon Ford. We're super excited to have a white coat here on the podcast in the studio today. We're talking about the Health Dare, which is a 90-day cellular health program. We're helping our clients reverse the symptoms of type 2 diabetes, high blood pressure, high cholesterol, IBS, and lose lots and lots of weight the healthy way. Our coaching team is changing the world one success story at a time. And today we're going to talk about the concept of integration. And I have someone here that we're going to try to integrate with today with our company and in the future. We're excited about this partnership. But first, before we can talk about integration, we have to talk about the opposite of integration, which is division. And there's kind of this age-old tit-for-tat Google, Facebook blow-up that you see online of the concept doctor versus health coach. Dun, da, da, da. My health coach shirt on today, superhero. So Dr. Shannon, welcome.
Thank you for having me.
We're excited to talk about a doctor versus a health coach. And, there's so many people out there that are, screaming the pharmaceutical versus the naturopathic or the prescription versus the preventative health care. And so there's a lot of holistic, the hippies are out there picketing the doctors' offices, stop the doctors. And the doctors think that the holistic community is crazy half the time because we are, So Dr. Shannon, talk to us a little bit about your background and your experience with nutrition.
Well, I am a doctor of chiropractic. So I went to school for 4 years, got my bachelor's in biology, minor in chemistry, then went to chiropractic school for 4 more years. So I'm a chiropractor, but as well, I am a teacher. So I'm a college professor of anatomy and physiology and biology, and love it. It's so much fun. But, I grew up around all of that because as a chiropractor, a lot of medical doctors are against us, but we want the best for our patients, just like everyone else. We want our patients to be healthy. I know a little bit about supplements and stuff like that, but not as much as you guys do about nutrition. So it was great to work with you guys and learn more and have it benefit me
absolutely
as an individual.
Well, and we kind of invited you in because you're not just a doctor, you're a doctor among doctors. I mean, you have been teaching doctors and nurses as a professor for how many years have you been teaching now?
So about 8 total.
8 years. Incredible. Yeah. So you've been teaching all of this knowledge about anatomy, and I know for a fact that you can run circles around me as a health coach with your knowledge of the human body. And so it's so exciting to me about what we're going to learn from you today. But why is it, with all this knowledge, that you were not able to get your own results? Tell us where you were when you came to the Health Dare. Even though you're a doctor, you're more brilliant than probably most of our coaches. We kind of consider ourselves to be, glorified cheerleaders,
Right.
So although we have phenomenal coaches here, people with degrees in nutrition and microbiology and exercise science and culinary arts. I mean, we have a wonderful professional team, but we're not doctors.
Right. Nor
do we claim to be. So why is it that you have so much more knowledge but you weren't able to produce the results? Where were you? Tell us about you.
Well, it's always a rat race. You're always on the run and, eating out the majority of the time because we're all so busy. And, I know what's best for my body, but that's not what you always do. So it was great to have all the encouragement and to have the nutritionist tell us exactly what we should be eating, kind of switch some things up, stuff like that, really helped us to get where we wanted to be.
Absolutely.
With kids, we have 4 kids at home. So with soccer and band and, all of those extracurricular activities, you're always running around and you're not always thinking about yourself. So as a doctor, you always think about your patients first, but it's more important to have yourself healthy first so that you can express that to your patients, how important it is to be healthy.
Yes. Well, and it's very interesting how we have so many doctors and nurses on this program. So we've had nurses, we've even had dietitians take the program. We've had yoga instructors lose a couple inches off the middle. We've had medical doctors, we've had chiropractors, and it's interesting. It's kind of like a massage therapist. The massage therapist is the one who needs a massage the most.
Absolutely.
Doctors are busy taking care of everybody else's health. And you guys kind of get us at the end of the line when we've made the bad decisions and we're squealing into your office like, my blood pressure's through the roof, and you got to figure something out and throw a prescription at us. So doctors need support probably more than the average person. But it sounds to me like you're also not only a doctor, a professor of doctors and nurses, but you're also a good red-blooded American mother with 4 children. You're not getting off easy.
No, not at all.
So you're doing all the things we're doing, plus being a doctor, taking care of your patients, taking care of your students.
Right.
So having all of that knowledge really doesn't do anything unless it's applied.
Absolutely.
Yeah. So that's fantastic. So tell us what kind of made you decide, all right, I'm going to call the health dare. I'm a doctor, but you know what? I'm going to call the health coach. I mean, what made you kind of bridge that gap for yourself?
Well, my husband had heard about it, and he mentioned it to me, and I'm like, absolutely, let's see what it's about. I have symptoms like many Americans. I had acid reflux, high blood pressure, and way more weight than I wanted to be carrying around. So I'm like, yeah, let's try it out. And when you guys told us about it and explained everything, it made so much sense. The best part is to have all the support from you guys and encouragement. And you answered all my questions because as a teacher, I'm used to answering the questions, but I had millions of questions, and you guys answered all my questions and, helped us out. And, since we started, I can't remember the last time I've had heartburn, which is fantastic because, popping Tums almost daily, that's not good for you at all.
Right.
My blood pressure is going down. I plan to continue even after the 90 days because I can see the results, see how good it is for my body, from the inside out.
Yes.
And I want to continue to see the success.
Absolutely. Well, and from what it sounds like your lifestyle is with 4 kids, teaching, doing all kinds. And I'm sure your husband also works full time.
Absolutely.
Okay. Running around like crazy. And apparently we're homeschooling this upcoming year.
Right now. Oh, I hope not in the fall.
Please, God, no. So we're all juggling this mom life plus business professional life, plus our marriages, plus all the extracurricular. So is this something that was easy to do?
Actually, it really was because, I started cooking more, but I used some of the recipes that you guys have, and they're not really hard. Mm-hmm. And I was able to eat a lot of the things that I ate before, but we tweaked some of the ingredients.
Yes.
And we used healthy ingredients. So I didn't feel bad eating spaghetti, and I didn't feel bad eating tacos and stuff like that I love so much. But we just changed up a few things, and the kids went along with it. So
that's right.
Trying to make them healthier at the same time,
That's exactly right. Well, and I lost 80 pounds on this program 4 years ago, kept it off. My husband lost 60 pounds and quit the sawing the logs to where I would go in the other room.
Right.
Sleep, So, for us, I love to eat and hate to exercise. And even if I wanted to, I don't have the time. And I'm like, please don't take away my food. Because as a busy mom, sometimes that's your only pleasure in life is binging on a mac and cheese. So as long as you know which noodles to do on your 5-cheese mac and cheese. And it's funny because I've been able to fake out my kids and husband.
Right.
With healthy food, and they have no idea it's healthy.
Right.
With their recipes. So that's a lot of fun. But let's talk about your results, okay? I have sitting behind me on this shelf. Now, if you're listening under the sound of my voice on the podcast, go to idareme.com and click on the docuseries and check out me and Dr. Shannon. We're waving at you. And come see this crazy amount of fat blobs behind me. This is the amount of fat, Dr. Shannon, that you and your husband have lost so far on the health dare.
That was just after the first 30 days.
This is after 4 weeks.
Right. 5 weeks.
5 weeks. 5 weeks. Okay. 5 weeks on the health dare. You guys lost this much weight. So I'm going to hand you the amount of weight you lost in 5 weeks.
I don't want it back.
You look fabulous, by the way.
Thanks.
Go see Dr. Shannon. If you're listening, you need to go to iderme.com. But this is 5 pounds of visceral fat. And visceral fat is really the only kind of fat that we care about at the Health Dare. We're not bodybuilders. We're not yoga instructors. We're not the gym. We just want you to feel good. And right when we get stressed and start to hit that middle age after a couple of babies, it starts to really cling.
True.
You know, is that also something that's taught in doctor school?
Sure.
Awesome. So this is the kind of fat. So this is your second one. That's 10 pounds. 15 pounds. This is heavy stuff. I'm telling you what. I lost a fat blob. And that is 20 pounds of fat.
Right.
Off
This
of your
is
middle
a ton.
section. So what we call that is Bob the Blob. So you lost 20 pounds of Bob the Blob in 5 weeks. Incredible. I've got your husband's other 5 pounds here. So we're going to put it all back. You don't want to hang on to it.
I do not want this back at all.
But it's so much fun because we take pictures with the fat blobs and jump up and down. And it's really incredible to see firsthand on a medical model of visceral fat how much that actually is. So when you lose this kind of fat, the pressure it takes off your body. So you're an anatomy teacher. Tell us a little bit about that.
So, fat is not great. You want to have more muscle mass and less fat. So being able to lose that fat takes pressure off the body. It allows the body to function better. And at the same time, we were building muscle. So
Right.
that's fantastic.
Right. That's awesome. So, and this going back to the doctor health coach, I am so excited because Dr. Shannon is now going to be joining our medical advisory board, and she's going to help us. She's going to become part of our curriculum development team. So listening to Dr. Shannon's knowledge and her experience has added so much to our program already. I mean, we were just talking about the curriculum, and she said, you realize there's no cell wall. It's a cell membrane. I said, well, I've been saying
Not in
cell
animals.
wall
Right.
for 5 years now. So she's corrected a little bit of her terminology. But, if we could just stop the divide in America between doctors and health coaches and work together,
Right.
then we could put together the most incredible healthcare system that mankind has ever known.
Agreed.
And if we would understand that our strengths and weaknesses can complement each other, you've got incredible amounts of knowledge. I can help you apply that knowledge practically. We'll come into your home, we'll grocery shop for you, we'll cook for you, we'll take you to the store and show you which labels to read. Then we could work together to help our patients. So the other day I was leaving my house and I actually came up on a car wreck. I was the first one on the scene. And I jumped out of my car, squealed up to it, ran up to the door, and a few other people started arriving. And I ran up and knocked on the door, and there was a lady inside. And thankfully, she was okay, but we were all waiting there for the medical professionals to arrive. And my shirt said health coach. I had the same shirt on, this health coach plastered across my chest and on the back, And people were just making way for me. Like, okay, here comes the health professional. And I thought, what am I going to do? Give this lady a carrot or give her 3 tips on green tea or how to walk or show her a label of spaghetti sauce, like there's nothing that I can do, We needed the doctor to get there. We needed the medical professionals to get there. So,
Right.
I kind of want to challenge the holistic community. Stop picking on the doctors. They're doing what they're trained to do and what we can never do, So let's stop criticizing the medical community and help them accomplish the goals that they have for their patients.
And work with them.
Absolutely. Let's find this marriage of conventional medicine and preventative nutrition, and let's put them together. Our diabetes patients need to manage their blood sugar, and that's the doctor's orders, and they need to
Right.
just stay on insulin and metformin until they're able to manage it.
Right.
Don't go off your medication unless your doctor tells you to. I can't stress
Right.
that enough. And let us help them manage the healthy habits. We're in this whole debacle of COVID-19, there's not a lot of information on it. Doctors are perplexed, we're perplexed. But if you got COVID-19, go to the hospital, get tested and get intubated if you need to, you know? But for those who don't have it yet, hey, let's get out the word that they need to take vitamin C and drink water and shed that excess fat, shed those, bad symptoms so you can build your immune system.
Boost the immune system.
That's
Absolutely.
exactly right. Now, Dr. Shannon, you are a chiropractor, so you did have a little more nutrition.
Yes.
Than the average doctor does.
Yes, and we still do continuing education. So we do 36 hours every 2 years. And I usually do nutrition seminars because they're interesting to me. I want to feel great. And I've learned a lot about supplements and it's great to be able to put that to use and have you guys help me out with the rest of the nutrition stuff as well. It's been good.
Yes, that's awesome.
I've loved it.
I love the open-mindedness that you have. Not all doctors are that way,
right.
And not all health coaches are this way. So, but yeah, it's exciting. And that's why we are putting together a medical advisory board because we want to know what we don't know.
Right.
Nobody knows it all. The medical field and the nutrition field are constantly evolving with new discoveries and they've got to work together. We've got a health crisis in America.
We do.
There's the top deadly conditions or the top causes of death. There are 8 of them. We have heart disease, cancer, accidents and injuries are just thrown in there, but chronic lower respiratory diseases like COVID-19, strokes, Alzheimer's, diabetes, the flu and pneumonia, and integration can bring us together to fight these in our country.
Right, because if you're healthy, then your immune system works so much better.
That's right.
You can fight off a lot of stuff, or you don't get the problems to begin with. We need to start at a younger age.
Healthcare.
Absolutely.
There's the mom in you coming out, which I'm going to put a shameless plug for Kid Fit Nation in here, evil Mr. Sugar, But, it's interesting because in Europe, in other countries, they don't even allow food marketing to children under the age of 18. It's just like cigarettes, just like alcohol, because they don't want them developing a sugar addiction. In America, we got Captain Crunch, Ronald McDonald, we've got the Trix Bunny, and they are already sugar addicts by the time they go to kindergarten.
I know.
No wonder we have autism and ADHD and ADD and all of these focus issues because they're in a fog.
Right. Full of sugar. And their brain is not working as well as it should.
That's right. So as a anatomy teacher, how does that work? How does sugar affect a child's development?
Oh, wow. Well, the concentration for one, they're just not thinking as well as they could. Like you said, the brain fog. They're so hyper from all the sugar that, they're not concentrating. So, they're literally vibrating in their seats,
Yes. My daughter does that. She's 4 and she does that, that sugar high. It's like her eyes just go wild and you're like, she's at a donut.
Look at me and pay attention, but it's not that easy when they're full of sugar.
That's right.
That's
right. It stunts their growth in every way. Intellectually,
Absolutely.
Emotionally, they can't connect with their kids. Obviously physically stunting the growth through unhealthy. We are what we eat.
Right.
And food is medicine, So if we're putting things into our children's bodies, they're not going to help them develop properly. That's where it all begins.
That's right.
But a lot of moms are like you and me. We may have the knowledge, but we're too busy to implement it. Or it's just not easy to implement it. Or maybe you don't have the knowledge. Maybe mom doesn't have the basic nutrition that she needs. That's where the health coach can come in and help you with grocery lists. And here's the kind of pasta sauce to buy. And here's the kind of mac and cheese to make. And here's the chicken nuggets that you can make your children.
Right. Or try avocado toast for breakfast instead of a Pop-Tart.
Yes, Ava the avocado. That's my favorite character in the Veggie Cast over at Kid Fit Nation. But integration, and I think there's 3 things that you need to accomplish an integrative approach. Now, I went to the Institute of Integrative Nutrition, integrating as much as possible with all of the approaches that are out there, because there's really something good in every one of them. I studied over 400 diets. I didn't study anatomy, so I'm going to leave that to you, Dr. Shannon. But integration is coming together. So in order to integrate for any relationship, whether it's doctor-patient, whether it's doctor-health coach, whether it's husband and wife, whether it's educator and student, whoever you're trying to integrate with, the first thing you have to do is find common ground.
Right.
And I think we found a lot of it here today,
We
right?
did.
But, you look at all these different health coaching companies or all these different doctors with different views, different types of doctors, internal medicine doctors, chiropractors, cardiologists, all these different kinds of conflicting views. There's all these fad diets. You got the Mediterranean diet, the intermittent fasting, the raw veggies, the people who are weighing their food in smoothies and, the vegans. And then you got the people over here eating chunks of cheese and pickles and meat
Right.
on the high protein. But all of them work. And I think all of them have the common factor of you shouldn't eat sugar. It's not healthy for you, eating cake and donuts.
But one thing that I found with the health deer, because my husband and I both tried the keto diet. And yes, we did lose some weight.
Sure.
But that's not sustainable. And the thing with the health dare, though, the nutrition is more inclusive. So you get a little bit of everything, and you're still able to continue with that kind of diet, and you're not ruling things completely out. And if it is, then you're substituting it for something else.
Absolutely.
So it's much easier to stick with.
Well, you can still have carbs because your body craves carbs.
Right.
You can still have sugar because your body needs the natural sugars.
Right.
You can still have your steak and potatoes because that keeps you from falling off the wagon and just binging in the middle of the night, So finding that common ground is so huge because every fad diet works for a minute.
Right.
But like you said, it's not sustainable. And if it's not sustainable, it's not attainable
Right.
for life.
Right.
For us busy moms, So number one, find the common ground in order to integrate. Number two, I think this is really important, lay aside your agenda for the good of those you're trying to help.
Right.
And that's what we've done here today. You're a doctor, I'm a health coach. We're coming together to talk to you, people that are listening out there, about the common ground that we found in order to help you succeed and to change and maybe even save your life by helping reverse the symptoms of type 2 diabetes and high blood pressure. And of course, all that stems from obesity. Preventative.
Right.
Absolutely. So we're laying aside our agenda today, a doctor and a health coach, and we're coming to you and saying, we're here for you. Dr. Shannon is sharing her results. She's bringing a perspective from the medical community, and we're here to help you and to serve you. And then the third thing with integration is build on points 1 and 2, which are find common ground and lay aside your agenda, work together to build a system and a process that can integrate two valuable points of view. And so I'm very excited. You're going to be reviewing our curriculum along with another panel of doctors, all different kinds of doctors and health professionals to bring it up to date to medical standards about every 6 months. And we're really excited about that because, we want to be what our clients need and what your patients need.
Right.
So thank you so much for coming today. And Dr. Shannon, okay, from a doctor's perspective, all right, if someone's out there watching us or listening and saying, all right, I'm skeptical, what would you say to them as Dr. Shannon Ford, having taken the health dare?
It's so easy. You should try it. We've had such great results. I feel better. I feel more confident in my summer clothes, which is always great. But not only that, I feel better. I have more energy. I'm still able to eat the stuff that I like. I just tweaked it a little bit. So not only that, like the health coaches have been so great. They encourage you. They applaud you. It's been phenomenal. And it's a way to get healthy from the inside out too.
Absolutely.
So
there's a lot of
something
unhealthy,
that everybody can benefit from.
Absolutely. There's a lot of unhealthy ways to lose weight out there.
Right.
You can lose weight in a very rapid, unhealthy manner.
True.
So sometimes people hear, okay, you lost 20 pounds of fat in 1 month. And someone might be listening thinking, is that even healthy? This doctor's talking about 20 pounds in a month. Talk to them a little bit about what that means, replacing the fat.
Well, as you're losing the fat, you're also building muscle. So that's more important for the body. Also gaining hydration, which is one of the big things that you guys talk about. And you don't realize how dehydrated your body is until you take the test and you realize like you're not getting everything that your body needs.
Yes.
So we were able to flush out a lot of the toxins in our body, replace the natural fluids, lose fat, and gain muscle. So
now, as a teacher at a university where you teach doctors and nurses and all that, and having all this extensive background for 8 years, have you ever had a doctor measure your hydration or ever brought it up? That's amazing.
Right.
So had you ever come across this cellular health concept? Does it line up with all the information that you knew? Does it line up with the anatomy and the physiology?
Well, sure.
principles?
We know that excess fat on our body makes the body harder to function. So with physiology, understand how every part of the body works. And when you have too much fat, it's hard on the cardiovascular system. You can build up all the plaques and stuff on the inside of the arteries, and it's not great for your body. So it can lead to heart disease.
Yes.
Too much sugar can lead to diabetes, and all of that stuff is rough on your body, decreases your life expectancy. So if you try this and, work from the inside out and live a healthier life, eat better things, then hopefully you can live a longer, more productive, and healthier lifestyle.
Absolutely. Well, and we're talking again about that internal visceral fat, not the little, subcutaneous fat on the outside of the skin, the cellulite we hate in our bathing suits, which I still have, by the way. We're talking about that internal fat, like you talked about the cardiovascular system. It squeezes.
Puts pressure, right, on the organs. So
Absolutely.
It makes it harder for them to function.
Absolutely. So the more of these Bob the Blob that you have, the less your body's going to function properly, right? So when we're losing visceral fat, we also want to replace it with water and muscle. So when we talk about losing 20 pounds of fat in a month, we're also talking about, or for 5 weeks in your case, we're also talking about replacing that with water and muscle the healthy way. So you're not just becoming anorexic, because your body does need a little bit of visceral fat, maybe around the heart, around the organs a little bit. You don't want to get
protection.
Exactly. So, but getting it out of control is where those bad symptoms come in.
Right.
So the belly fat. So, Dr. Shannon, is there anything else that you'd like to share with our audience today?
Just that we've had some fantastic results so far. We weigh in next Friday, so I'm excited about that to see how many more of these I can add on. And, we want to stick with it and, keep up with the diet and, hopefully, get the kids healthier as well.
Absolutely.
And,
Absolutely. Well, and thank you so much for lending your knowledge and your expertise to our company to make it better and to help us develop our next 2.0. Actually, technically, it's about a 5.0 curriculum that we're developing, because it always needs updating. It always needs refreshing, because the medical community and the nutrition community are constantly evolving, and we're evolving together, and we're integrating our strengths and weaknesses and our skills and our knowledge to serve you. So thank you for listening. Thank you, Dr. Shannon. Thank you for listening to the Health Dare podcast. If you like what you heard, go to idareme.com and contact our coaching team for support. You can call 1-877-I-DARE-ME. I'm Coach Bridget, and Dr. Shannon Ford and I look forward to hearing your story. We dare you.